Good evening. Welcome to 90-day University Professional Pre-Final Mastery course by Auricle. Today is the class about basic statistical concepts and measures. Right. In this, we'll be having rapid revisions of all important questions, volatile facts, high-yield topics, and most expected topics will be covered. However, the basic statistics which we are learning in biostatistics today will be you have all learned about this during your plus 10 or plus 2. 10 or plus 2. Okay. Today we'll be discussing about importance of biostatistics in health, public health area, and different types of data and their importance, measures of central tendency and mean, median, mode with examples, dispersion, and the significance, descriptive and inferential statistics. Why choose Auricle? Auricle is a place where you get 5 modes of learning, that is recorded classes, live classes, practical sessions, exam modules, and hard copy book sets. In foundational classes, you will be having flexible learning. It is a convenient way of learning. You can revise whenever you want, and it will be from our top educators, which is very much required for your preparation in MBBS exam as well as FMGE exams. Next, we have live classes where the topics will be covered in depth to the content by the experienced educators, and you'll be having interactive learning. In express exam module, the syllabus is completed in 20 hours, which is less than a day. You can revise your complete subjects within 20 hours, and you will be taught about how to write the answers, and you will be given flowcharts also so that you will not miss any marks in your exams. You will be getting one-to-one doubts clearance session where it is a safe learning environment for all the students, and it is student centric in approach, and you'll be having one-to-one attention also. You can ask any doubt at any point of time and clear yourself. With this, you will be having a hard copy book sets so that you can read whenever you are not in access of the internet or you are tired of looking at the screens for longer time. So you can revise with your books. It covers all the 10 years past question papers, and again you can read all the most important topics from here. With this, you'll be getting a question banks, which is at customized one, which is for 3 levels, that is from beginner to expert level, which is beneficial for professional exams, NEET PG exams, and as well as FMGE exams. With this, you will be getting a practical sessions also where you can face your examiners with complete confidence without any hiccups. Okay, you can face your examiners with like flat. For this, will be having 4 subscription plans. That is foundation plan of 3 months, that is for 19,999, and advanced plan of 6 months, that is for 32,999, and complete learning plan for 12 months for 59,999, and ultimate MBBS plan for 1.9 lakhs. Do not worry about the fees. You will be having a very good discounts. Please do use the discount codes displayed below. Okay, first we'll be having biostatistical concepts and measures. Okay, the first question for today is define and explain importance of biostatistics in public health. Okay. What is the importance of biostatistics? Biostatistics is a branch of statistics focused on application of statistical methods. Okay. And it involves in interpretation of the data to address the health related issues. Coming to the importance, just an example. Okay, disease it you can use the biostatistics in disease surveillance and monitoring. Okay, like in COVID-19, there was a model developed which is known as susceptible, infected, and recovered model. This was used to forecast the number of cases which can occur in the future and if there is any requirement of lockdowns or not. Designing and analyzing clinical trials. Again, when the COVID-19 was there, the statistics were used in by like to develop the RCTs, and trials of vaccinations were done using the biostatistics to to measure the efficacy or the efficiency of the vaccine. Identifying risk factors for disease. Again, Framingard study utilized statistical analysis to identify high blood pressure. You need a cutoff level for high to say that the blood pressure is high, or it is to say it is too low. Okay, you want to say the cholesterol had a bad effect on cardiac events of all the heart attack patients, then at what level the cholesterol is considered to be normal? It is considered normal at 200 level or 150 level. All these things can be decided using a biostatistics. Evaluating public health interventions. How? What is the total number of cases of polio infections before the vaccination and after the vaccination? Is it really significant to give the vaccination? Again, this can be evaluated using the biostatistics. Environmental and occupational studies derive the association between the cause and the effect. Okay, and to develop models to check whether the disease has any impact in the future, like vector-borne diseases like malaria and dengue was modeled statistically to predict future outbreaks and design the preventive measures. Otherwise, why do we have preventive measures like spraying, fogging, and supply of mosquito repellents? All these things are coming to picture because of the future prediction of future outbreaks. What all this lead to? This helps in policy development and implementation and holding the public health campaigns. You can't hold a public health campaign of smoking in a place where the tobacco is banned. Okay, to formulate policies and to hold it indirectly saying that to redistribute the resources, statistics can be used. Next, we have explain the different types of data and their importance in public health studies. Public health studies uses various types of data. That is, it can be based on trends or outcomes. Broadly, it is classified into quantitative and qualitative. Quantitative, again, which can be quantified. Qualitative, it is cannot be measured in numbers. Quantitative data is measurable, used for comparison, involves counting of people, behaviors, conditions, or other discrete events. Counting, not measuring in this quantitative. Okay, quantitative data, it is measuring here. Uses numbers to determine what, who, when, where, and where of health related events. You can measure the age, you can measure the weight, you can measure the temperature, you measure the number of people suffering from diabetes or a particular disease. There are two types of quantitative data. One is continuous data and one is discrete data. What is continuous data? Data that can take any value within a range. I'll come to this later. Examples like blood pressure, 120 or 80 millimeters of mercury. Cholesterol, again, it can't be cholesterol, you can't say it is 200, you can have 200.5, 200.8, 180.8. So this is continuous.
बोला आप जब जियो सिग्नल के पास जाने
Yes, sir.
करेंसन
Yes.
उसी
Yes. Sorry for disturbance. There are two types of quantitative data, that is continuous data and discrete data. Continuous data is you can measure in the decimals also. Okay, but discrete data you can't measure in the decimals. You can say number of children are 4 or 5. You can't say 4.5 or 3.5. This is what is discrete data. Okay. You can't say 3.5 are infected or 4.5 infected. You have a complete whole number in this. Whereas continuous data has decimal points also. Qualitative data is a broad category where you can not measure, or you can't say who is high or who is low. Okay. Which is more or which is less. You can't say male is more or female is more. They are both equal. Okay. Smoker and non-smoker, again, you can't quantify a number that smoking is higher or non-smoker is lower. You can't do that. Or expression of uh, emotional feelings, like I agree to this point, I don't disagree to this point, I am neutral to this point. These kind of things are certain by, are measured by, are also called as qualitative data, perception measurements. It can be nominal or it can be ordinal. If it is nominal, you can't say which is high or low. That you can say, example is already written, blood group AB and O. Disease, if it is there, yes or no, gender. You can't say which is high or more, which is high or which is less. Ordinal data you can't quantify, but still you can say the severity of disease or socioeconomic status, low, middle, high, or mild, moderate, severe. These kind of things are called as ordinal data, but this can't be measured by numbers. Okay. Where do we get this data from? There are two ways of getting data, that is primary data sources and secondary data sources. Primary data sources is from which you collect from the individual, okay, which you get it from by getting the answers from the individual, or which you measure. What is the advantages? You collect the exact information and you can test that information, okay, and there is no interference in that information. Whereas secondary data is, it is collected from the existing data resource. Okay. What is that existing data resource? That could be registers. Okay. From any of the, if you are doing a study on surgical procedures, you can get it from the OT, which is already there. Okay. Or the national estimates, like how much of tobacco is sold. Based on that, you can get the consumption of the tobacco overall in the country. That is called as secondary data. Advantages of this is you can use in large samples and it is less expensive to get the data. It takes less time also. And you don't have to worry about consent because no one is involved. It is already existing data. Okay. What are the issues? This you cannot get the particular data of the individuals, or the data entered might be incorrect, or there might be incomplete data for particular individuals. All these are the issues faced during secondary data collection. If you're using the data collection as a from the secondary sources. What is the importance of different types of data in public health studies? To understand the disease pattern. Continuous and time series data help to identify the trends and risk factors because of the based on the seasonality of the influenza. That is one of the examples. To monitor before and after the intervention. Again, to modification of the policies and formulation and modification, both of them. Identifying the disparities, predicting the future models for outbreaks. All these things are done using the data which is existing. Next, we have what are the measures of central tendency? Explain mean, mode, and median and mode with examples. Okay, it is very simple one. You have already done in your 10th standard. The same things are being taken now. Measures of central tendency are statistical tools used to identify the central or typical value in a data set. Okay, there are three measures. There are the next question also is there, that is measures of dispersion. Understand the basic meaning. Here it is central tendency towards the center. There it is dispersion away from the center. There are measures for measuring towards the center, and there are measures which are used for measuring the dispersion from the center. The measures for measuring towards the center are called as central tendency. Mean, median, mode. Don't write like this in answer because it is a layman terms which I am saying. Okay. What is mean? Mean is just means an average, arithmetic average. You take the blood pressure, systolic blood pressure, add it, divide by number of readings, you get the average. Okay. That is how the mean is calculated. The examples are very simple. Median is the middle value if you are arranging them in a ascending or a descending order. You can't say that 2, 8, 4, 3, 5, 8, 10. You can't say that this center value. The value is the middle value when you are arranging from ascending to descending or descending to ascending order. Okay. You take the central value. For example, here the central value, there is e this is the even number of values, so you take the average. However, there is no even value. There are 5 readings. The reading is the middle reading is 30,000 arranged in the ascending order. Here it is arranged in the ascending order, but there is no middle value, so take the middle 2 values and divide by 2. Okay, that is the median. Median, it identifies the realistic representation. More, it is the most frequently occurring value in the data set. That means the value which is more repeated times. Okay, you calculate it. A, there are 3 times. O, there are 3 times. And again, P, 1 time. Here the blood types of 20 patients. Okay, I think this data set is incomplete. If you say, then I think it is incomplete. Okay. The most frequent diagnosis in emergency room is like C, fever, fever, and fever. These are the 3 data sets. Okay. What is the crux of this question? Mean, it is identifies the trends. Median focuses on uh, removing the outliers. The data, your value does not get skewed by the outliers. More, it helps in allocation. Mean, it helps in the trends. Median by does not get skewed by the outliers. More, it helps in allocation. These are the 3 things. Now we will see what are the measures of dispersion from their center. Okay. Measures of dispersion quantify the spread. Central tendency quantifies the accumulation, whereas dispersion quantifies the spread of the variability of the data set. Like mean, median, mode for central value, dispersion also has something. That is range. The difference between the maximum and minimum values in the data set is called range. Okay. Simple measure of dispersion indicates extent of data spread. Okay, the range is over 40. Okay, the highest value, difference between the highest value and the lowest value. Next, we have interquartile range. The range of middle 50% data calculated as difference between 75th percentile and 25th percentile. I will tell it how. This line is divided into 4 parts. Okay, equal 4 parts, right? 0, 25, 50, 75, and one more is 100. Okay, this is what is the interquartile range means. The interquartile range of, if we say middle 50% of the data, that includes this. If you say the interquartile range of 50%, first 50% of the data, that includes this. Okay, last 50% of the data includes this. Okay, this is what is that. This is Q1, Q2, Q3, and Q4. Okay, Q1 is 20, Q3 is 40 year, Q4 is what? What say sorry, this is 25%, this is 25. Sorry. I'll explain with the example, don't worry. This is Q1, 0, Q1, Q2, Q3, Q4. Okay. This is Q3 and this is Q2. 40 minus 20 is the interquartile range. Okay. It reduces the impact of outliers. One data will be somewhere here and one data will be somewhere here. The 100th data is very closer. So it avoids the interquartile. When you take the interquartile range, it avoids the outliers. Okay. Variance, whatever the mean is there must be a variation from that mean. Okay, the average of squared differences between each data point is called as, and the mean is called as variance. Okay, x bar is mean, that is 4 for the data set of 2, 4, 6, and number of observation is 3. Okay, when you calculate 2 to the power 2, 2 minus 4 to the power of 2, and 4 minus 4 to the power of 2, and 6 minus 4 to the power of 2, that is 2.67 is the variance. Okay, this provides the variability in squared units, essentially in inferential statistics. Why squaring is done, we'll take it later, to avoid the negative value. When this variance, if you put a square root for this, it becomes standard deviation. You are standardizing the deviation by squaring it, so by taking a square root of variance. Okay, then it comes as 1.63. This indicates average deviation of data from the point of mean. If this is the mean, it can deviate from here also to the positive side also, negative side also, and positive side also. If it is 0, the data can vary from minus 1.63 to plus 1.63. That is how it is expressed. Your data is, most of it are in this area, that is 95% of the data stays in this area. Coefficient of variation, the ratio of standard deviation to the mean expressed as percentage. It is expressed in percent. Okay, it normalizes dispersion across the data sets. If you are using 2 or 3 data sets, then you use the coefficient of variation. What are the uses of dispersion? It helps in identifying differences in outcome. Like you are taking blood pressure of one group. Out of them, 8 are in the range of systematic use. Instead of blood pressure, we'll take glucose. Okay, blood glucose levels. Patient number 1 has blood glucose level of 100. Okay, and the patient number 10 has blood glucose of 200, whereas the remaining 8 people, the blood glucose is in the range of 150 to 180. Okay, now there are 2 outliers. To measure this variation, this central measures of dispersions are there. Okay, it helps in identifying the outliers and to differentiate the variability within the data, so that you can assess the risk of the disease. Comparing the data between groups as well as intervention and within the group itself, and to identify the gaps where the resource allocation is less, and for quality control. These are the places where you can use measures of dispersion. And the last question for today is differentiate between descriptive and inferential statistics. Descriptive statistics summarizes and organizes data to provide a clear overview of data sets. It deals with what is the average patients in the clinic, age of the patients in the clinic. It does not give any analytics. It gives the description, that's all. If it is how many blue color charts in your room, okay, it does not give what is the effect of blue color chart in your room. That is what is descriptive statistics. Inferential statistics, it draws conclusion. Okay, it gives you the predictions and you can test the hypothesis about the population based on the sample. What is the purpose of this? Descriptive presents the data in an understandable and interpretable format. Any layman can understand. Whereas inferential statistics you can use the data to generalize it to the overall population, focusing on analyzing and predicting beyond the given data. Methods and tools in descriptive statistics use measures of central tendency, dispersions, and charts, whereas in inferential statistics use to test the association or the regression values. That is, we use confidence intervals to estimate. We can test the hypothesis by using t-test, chi-square test, ANOVA, and predictive models using regression analysis and correlation. This you can get through inferential statistics. Descriptive statistics focuses on the sample or a data set provided. In inferential statistics, it makes assumptions about the population. You need to give the total population, while you need to have the total population or assumed population in inferential statistics. Assumptions do not rely on probability, or assumptions are not required, where in inferential statistics, it assumes the randomness. For example, population study average height of 200 patients. In inference, you can predict the average height of all the patients in a city. If you are taking a disease, 60% of the sampled patients have diabetes. With this, you can estimate the diabetes prevalence in the entire population. Clinical trials, you get the summary of the treatment, whereas you get the comparison of the treatment in inferential statistics. Okay. In hospital, again, you can say in descriptive statistics, average length, whereas in inferential statistics, you can compare between hospitals or between wards or between the departments. Reliability, inferential statistics involves uncertainty due to sampling errors, and it has assumption to a larger population, whereas descriptive statistics for a limited population. Significance, descriptive statistics identifies trends, whereas inferential statistics helps you make decisions. Okay. We have MCQs for today. That is, biostatistics is primarily used in public health for analyzing clinical cases, studying disease distribution and determinants, managing healthcare facilities, providing medical treatment. The answer is studying disease distribution and determinants. Original dataset is represented by blood pressure readings, gender categories, pain severity on a scale, and weight measurements. Pain severity on a scale of 1 to 10. Ordinal data. It is not original data. It is ordinal in nature. Okay. All three are, this is nominal. It is quantitative. This is quantitative. This is only in order. Which measures of central tendency is most affected by the extreme values? The answer is mean. Okay. The sum of squared deviations from the mean divided by the number of observations is called standard deviation divided by number of observations is called coefficient of, it is called variance. Squared deviations, it is not square root, it is squared deviations divided by number of observations is variance. In descriptive statistics, the primary purpose is to make predictions, test hypotheses, summarize and describe data, identify causal relationships. In descriptive, you can't do the associations, or you can't do the predictions, and you can't test the hypothesis. It is summary and describing the data. The median of data set is 28357. 23578. So the middle value is 5. Arrange it in a ascending order or a descending order, take the middle value. If 2 are there in the middle value, take the average of it. When a data set has 2 modes, it is called trimodal. That means there are 3 types of variations. Bimodal, 2 types of variations. Multimodal, many number of variations. Unimodal, it is only one way. There is no variation, there is only one set of value. Here it is 2 modes, it is bimodal. The standard deviation is average squared deviation from the mean, square root of variance, difference between the highest and lowest values, middle value of the data set. It is square root of the variance. Categorical data is best visualized using a histogram, scatter plot, pie chart, and line graph. It is best to do in a pie chart. The range of data set is, again, arrange it from lower to higher. 4, 7, 9, 10, and 15. 15 minus 4, 11. The answer is 11. Okay. Thanks for watching Auricle. All the best for your exams. Keep reading. We have social media handles for Auricle on YouTube, Facebook, Instagram, and Telegram. And we have app users for on Google Play for Google users and on App Store for iOS users. Thanks for watching. See you in the next class.